Okay, so this is going to be my newborn assessment. This is Abby. She's my newborn, delivered by Amazon about a day ago. She is generally healthy. Just going to go through her assessment really quickly. I'm going to start off with her general appearance. So her color is appropriate for her ethnicity. Her face, eyes, ears, nose are all symmetrical. Breathing on her own. Symmetrical rise and fall and chest expansion. I'm going to go ahead and assess her heart sounds really quickly. She's got a little bit of a murmur, patent ductus arteriosus. And I would assess her apical heart rate for a full minute. I'm going to say her heart rate is 125, so she is in the normal range. Next, I'll listen to her lung sounds. Her breathing is generally unlabored, no grunting, no snorting. Now I would assess her respiratory rate for a full minute as well. Hers is 45, so right in the middle. I'm going to go ahead and auscultate her bowel sounds really quickly. And her bowel sounds are normal active, so she's got some movement going on down there. So I'm going to go ahead and assess her brachial pulse, her brachial pulses. And they are strong and equal bilaterally. Her femoral pulses. Are also strong and equal bilaterally. I would rate them +2. Don't have a thermometer. I'm going to say her temperature is 36.9 degrees Celsius. So that'd be in the normal range for her. I'm going to weigh her. Use my handy dandy food scale here. So she is 184 grams, which would be very alarming if she were a real baby. I'm going to say she's 2,700 grams, which would put her in the normal range. Next, I will assess her length. I'm going to measure from head to toe. She is about 26.5 centimeters. Oh, I guess you can't see me there. About 26.5 centimeters. She's a short baby. And her head circumference. I'm going to measure right above the eyebrows. So the widest part of the back of her head. About 22 centimeters, which is again pretty small for a regular baby, but for her it's just right. Her chest circumference, which should be about 2 centimeters smaller than her head circumference. Hers is about 17. So we said the head circumference was 22, so 5 centimeters shorter. And her abdominal circumference, we can do that as well. So she's actually a little bit wider around the abdomen, about 19 centimeters, a little bit wider than her chest circumference. So her skin, let's assess the skin. She has no apparent birthmarks, no Harley Quinn signs, no Mongolian spots, no milia. She is very pink, again appropriate for her ethnicity. No acrocyanosis is evident. Her head, assess her head. She does have a soft spot in the front and her back. Her fontanelles are not closed. No bulges or no sinking in. No caput succedaneum. And no cephalohematoma. It's completely smooth all the way around. Her eyes are appropriately placed. Pupils are equal in size. Do not have my pen light. She's very focused on objects straight ahead of her, not so much to the left or to the right of her. No mucoid discharge, no tears, no eyelid edema. Nostrils, we'll say her nostrils are flaring. Obligate nose breather. No sneezes though. Ears are appropriately placed. The top of the pinna lines up with her eyes with the outer canthus. So I'm gonna try to elicit a moral reflex from her startle reflex. And she jumps. So I'm gonna assess her mouth and pretend my hands are gloved before I stick my fingers in her mouth. So she's got a sucking reflex. Not quite a gag reflex, a little slow on the gag reflex. Uvula is midline. She's got no Epstein pearls. No little teeth. Her frenulum looks like it's properly placed, it's not too short. Tongue looks like it moves fine for her. I don't think she'll be a feeding risk at all. Try to keep her in view. So her neck is a little bit stiff. As you can see, her tonic reflex is in effect. Turn her head to her left, and her left arm extends. Little fencer. Her clavicles are intact. They were not damaged in the birthing process. She's got no webbing of the neck. Thyroid is not palpable. She's got no distended veins. Not sure if I would call her barrel-chested. Maybe barrel-chested. Her AP to transverse is about 1-to-1. Or 1-to-2. It's got no breast engorgement, no nipple discharge. And breath sounds were assessed when I assessed her respiration rate. Abdomen is mildly protuberant, just a little. Liver is not palpable. We tossed the placenta, but she did have 2 arteries and 1 vein connecting her. Bowel sounds were present. She did have her meconium. So for the genitalia assessment, we'll say her labia is a little edematous from those maternal hormones. No blood tinged discharge. She has voided. Her extremities, symmetrical flexion and abduction, abduction. She's got good range of motion. Let's count her digits. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 2, 3, 4, 5. 1, 2, 3, 4, 5. She's got her left fist pretty clenched, you can see. It's her grasp reflex. Nice and strong. Palmer grasp. Plantar grasp. She curls those toes. And Mabinski, give her a little stroke. She fans her toes. Her hip dysplasia. Do the ortoloni maneuver. Flex the knees. And abduct the hips. So no crepitus, no clicking. Sounds like the head of that femur is gliding smoothly in that acetabulum. Humerus and femur are intact. She does have a little bowed-legged appearance. Don't tell her that, she's self-conscious. So I'm going to assess her back. Spine is straight and intact, no curvatures, no humps. It's got no dimpling, no tufts of hair. Not much of a crawling reflex. Yep, there it is. She pushed away. And the Galen reflex, stroke one side of her spine, and she laterally flexes towards that stroke. Other side, lateral flex to the other side. And then her neuro assessment. Oh. And check the anus. The anus is properly placed and patent. She has been able to go. Does have the wink reflex. And neuro assessment. Which of these haven't we done? The rooting and sucking. So she does root. She looks for that source when you stroke her cheek, and the sucking reflex. Swallow. She has swallowed. She is able to eat. The Moro, she was startled when I clapped my hands a little earlier. The Babinski, her toes fanned. Palmar and plantar grasps. She did those. Toes curled, hands curled on pressure. Galen reflex, she did laterally flex on both sides. Crawling reflex, she did push away when I touched her foot. And fencing, she was a little fencer. Turned her head and she reached her arm out to that side. And the walking reflex. Let's stand her up, and she does reach for the feet. She does reach for the counter like she does want to walk somewhere. And that completes my assessment. So Abby is healthy to my knowledge. She passes the assessment. I will document all these findings and return her to her mother.